Hi, how are you doing today?
I'm doing well.
Are you Miss Atiana?
Yes, I am.
Okay, my name is Sandra. I'll be performing an eye and ear assessment on you today.
Okay.
Do you have any questions?
No, I don't.
Okay, first I'm going to start with the visual field test. If you can follow my fingers while keeping your head straight.
Okay.
Okay. All right, and that's within defined limits. If there's any shaking or if she's struggling to follow the finger, that may be a sign of nystagmus. Next, I'm gonna do the cover and uncover test. I'm just gonna have you cover your eye, look straight ahead, focus on that object on the wall right there, and just switch hands.
Yeah.
Switch. Okay, let's switch again. Okay, one time. All right, and that test was within defined limits as well. If she had an eye that would move while to readjust and refocus, that would be a sign that the eye is weak. Next, I'm gonna do the red reflex exam. I would dim the lights and I would use my fundoscope, and I'd be about an arm's length from the client. It's gonna readjust this. Be about an arm's length from the client, and I would elicit the red light reflex. In adults, absence of the red light reflex can mean retinal detachment, and in infants and children, it could be a sign of retinoblastoma or congenital cataracts. Okay, so I'm just gonna turn on the light, and if you can just look straight ahead for me. Okay, and I see the red light reflex in both eyes. Next, I'm going to examine each eye using my fundoscope. I would start with my setting at 0, and then I would look in both eyes. I would be looking for the optic disc. I'll be observing the color and shape. For the physiological cup, the diameter should be half of the optic disc. Then I would look at the retinal vessels and examine for AV crossing or any nicking. Then I look at the retinal background for any lesions, exudates, hemorrhages. And lastly, I'll look at the macula for the color and surface. And while I'm looking with the light. Okay. So when examining the right eye, I would be using my right hand. I'm just gonna adjust the settings, make sure the light is on. Okay. All right. And I would use the brow to lift the eye up, and I'll come closer. Okay. And I'll use my other hand for the opposite eye, and I'll come closer to fully examine. Okay. And everything is within defined limit. Okay. Next, I'm going to assess the ears. I'm going to change my device. Okay. I'm going to examine both ears. I'm going to make sure that the corner of the eye matches up with the pinna. Low set eyes can be a sign of a congenital defect. Cornea, pinna. I'm also going to examine the pinna of the ear for any lesions, any exudates. And do you feel any tenderness in your ear?
No.
Okay. And if she were to have any exudates or any pus coming out, that could be a sign of an infection. I'm just going to examine the external ear for any lesions. Normal amount of earwax. Okay, and if it was inflamed, that could be a sign of otitis externa. Okay. I'm just gonna palpate. Do you feel any tenderness?
No.
Any tenderness?
No.
Okay. All right. So there's no tenderness, so I don't see any signs of otitis externa at this time. So next, I'm gonna go ahead and continue to use my otoscope to examine the ear. 1 second. Making sure it's intact. 1 second. Make sure it's tight enough. Since I just switched it out. Okay. And for the techniques for adults, you will pull up, out, and back. And for a child under 3 years old, you'll pull down, out, and back. So I'm gonna pull up, out, and back, and I would hold it with my hand brushing against the cheek, and I would go in and observe both ears. Okay. And I would observe to make sure the tympanic membrane is pearly gray, intact, no bulging, retractions. I'll make sure I can see the cone of light, and I would see if there's any movement and fluid. And to do the pneumoscopy test, I would increase, as I'm looking, I would press the bulb lightly, and if I should see movement of the tympanic membrane, that means it's within defined limits. If I don't see any movement as I'm pressing air, that could be a sign of fluid or perforation. Next, I'm going to move on to the hearing test. I'm going to start with the Weber's test. With the Weber's test, I would initiate and have this in the middle of her head, and I'll ask, do you hear the sound in both ears, in the middle, or on one side, right or left? If the sign lateralizes to one side, that could be a sign of conduction loss for hearing, the side that it lateralizes in, or if it's in the opposite side, it could be a sensorineural deficit. Okay, so I'm gonna elicit this and just let me know if you hear it in both at the end.
Okay.
Okay.
I heard it in both.
You heard it in both ears?
Mm-hmm.
Okay. And the next test is going to be the Rhines test. With this test, the air conduction should be heard longer than bone conduction. If bone conduction is only heard, or if it's heard longer, that could be a sound of conductive hearing loss in that ear, or in one of the ears. So let's try it again. And whenever you stop hearing it, you can say now.
Now. Now.
Okay, I'm gonna text the next ear.
Now. Now.
Okay, so with both ears, air conduction was greater than bone conduction, so she passed the Rhines test. And that is the eye and ear assessment.